of the show, our three questions that
with Sugar Fix in Chicago with Dr. Jessica Emery. So thank you so much for jumping on.
I mean, I'm still gonna work on it, but yeah.
And then right away, as soon as that first thing comes out, they sign up for it.
Anyway, so I got to see the first half of the video that you did with Ali, our event coordinator, and that was really awesome. And when I was watching the video and I saw that you guys have a photo booth at your dental office, that's really cool. Like a lot of dental offices have like kids play area. There's like a lot of like neat things, but first photo booth, right? So I definitely wanted to get you back. And obviously I'm a different person. You're dressed differently. This is a different day, but I'm going to put it onto the same video. And some other things I noticed when I was like looking at the video, and then like, you know, because two heads don't always talk, right? So I started researching into, you know, your about me on your website and stuff. And I noticed some like really cool things like collecting cooking books across different countries.
Yeah.
So like you visit cities in different countries and then like maybe like try and bring back like a favorite taste from there or something, or
Yeah, that's the kind of thing that we used to do anyways, you know, when traveling was allowed.
right. Yeah.
But you know, you going to, you know, food is such an important part of every culture and it's so unique. And you know, I really enjoy good food, so you know, that is a big part of the memory. So when we were traveling, we'd also start doing food tours or just, you know, figuring out what the locals eat. And, you know, every culture has very unique flavor mixes. And,
Right.
you know, the cooking book would bring that taste home. So I had a friend, she went to Paris for, you know, for college. And she gave me a cooking book, like in French, or a French one. And you know, I thought that was pretty cool because it was also written in a very different way. So very different than American cookbooks.
Yeah, I mean, you would get things not just in milliliters, but I've seen how they like instead of saying like 1.5 cups this, I've seen cooking books from different countries where you get things in parts, like especially with bread and stuff like that, or weights, right? So like instead of getting a cup of this, there'll be like 40 grams.
Yeah, it's not just that. I think, you know, in American recipes or, you know, North America at least, they're very, very specific. Like they're going to say an 1/8 teaspoon of, you know, salt or something, or the spice. And it's very, very specific. And the French cookbook was like, add some salt, add some milk. And I'm like, I don't know how much milk I'm supposed to add, or it's like cook until done. You know, will tell me like how hot is my oven. You know, they expect you to know more, I think. But you know, that was the weird thing about that. So
No, that's really cool. I don't collect cookbooks. I like to do a lot of cooking. Like, I like to sous vide and barbecue a lot, but like I like mixology. Cocktail making is awesome. And old cocktail books would just call for an ingredient that was like some mixer that they used a lot then.
Right.
But you would be like, wait, what is that? You know, it's kind of something like, you know, rose water in and of itself is like a mixture of things. It'll just call for rose water. It's like, okay, well, I need to know how to do that. Right. I need a reference to that to get started. Right. And then, so you're also into drawing and painting, and a lot of your artwork in your office is your own. Is that like?
Yeah. So I you know, for a long time I was kind of planning to, you know, in my house to do artwork myself, just because you know, if I wanted a very specific idea, you know, specific blend of colors there, a specific theme that matches throughout, you know, the house or tells a story, you know, it's hard to find that on sale, or you have to commission somebody to do it. And so I thought, okay, I have to I'd rather do it myself because I can plan it out exactly how I want to be. And the same with the office, because let's say I want, tooth or dental themed, but have certain spin, certain colors. It's a lot of work though, so I don't really have a lot of times, but it's just something to do to relax working on painting.
Yeah, I think hobbies are pretty important. I tend to go home and work, and that can be damaging to,
Yeah,
just,
me too. And then I started um, putting aside a little bit of time once a week to do something non-work related.
well, that's cool. And then I started looking through, it's pretty clear you probably don't have a lot of time since you're on the, let's see, you're on the board of the American Academy of Cosmetic Dentistry,
Not on
and
the main board. I'm on a small board, but
a
yeah.
small board, not the main board. That's all right.
Yeah.
I'm not on any boards at
Yeah.
all. I'm waiting for the invites, but I don't think they're coming. But so in your guys' office there, you have so you do massage chairs. Like, so are they like, is it built into the dental chair, or is it like something on top of it, or?
It's inside. Yeah, it's
Oh, that's cool.
Yeah. It's not
find,
a
like,
very intense massage. I mean, you can't do dental work like that, but it's just nice and soothing, nice and relaxing.
Right. So like, I think like the seats on my car have massage.
Exactly. So that's the
and
kind
like, yeah. Oh, that's pretty nice. So on to this photo booth. So what I did was you had some videos of some of the things you've done, and so down here at the bottom of our screen, this is actually from inside your guys' office, right?
Mm-hmm.
Okay, so it kind of starts with you even start with makeup and hair, it looks like.
Mm-hmm.
And so now, do you just have the hookup with a makeup and hair person, or do you like bring them in, or?
Yeah, that's what I do. And a lot of times makeup artists, they want to get good photos. So you just make a deal with them.
Right. So like, they want I think in my photography days, what was that, trade for press kind of deal. Yeah. Yep. And so this is like, so you just have like this room devoted to this all the time.
I do.
Is that the case? I was looking at this setup. I see you got a nice reflector here. And that looks like we got like a strobe flash inside of like a umbrella flash here.
So it's not it's an octabox. It's not an umbrella.
Oh, okay.
Yeah.
Let me see. And what kind of a flash is in the? Is it like, I assume there's a, okay.
Yeah.
And you guys are using probably like a wireless trigger on the camera itself then?
Yeah, exactly. So there's a beauty dish.
Tying them all together. Okay, wow. That's a nice setup. Now, did you guys just, how did you already know like what flashes you wanted for this? For like,
yeah, I just kind of, I played around, but I used to, before going into dentistry, I used to work in the fashion industry for a couple of years, and I even worked as a model, since I was in high school. And so I've been around a lot of professional photographers, and I saw what they use. And so I kind of got some ideas on what I wanted to do as well.
That's cool. And I was looking. So this is you, right? This, you're doing the photography. You're doing a little helping them get the understanding of like how to hold their hand, how to not just hold still for every single shot, because you don't want 300 shots of the exact same, like.
Yeah, some people are very difficult to get them to, relax. Right. They feel like they have a certain position that they need to be in all the time for their photos, right? So you want to get
right, the selfie era, like people have like, no, this is how I stand for pictures. And it's like, and like, it's like, well, I mean, we're going to take like 50 pictures. So, you know, you move and we'll see. Maybe that's not how you stand for pictures. But this is really cool. So this is like if you guys do orthodontics there, I assume as well. Yeah. And just kind of like now, are these like when you first get your braces kind of like make you feel more comfortable about having braces, or like kind of like progression shots? Because I noticed like one of the people was wearing braces, so I was like, well, this isn't like a post shot. So
yeah, well, this one you know, we kept the braces on still because it was I wanted also that kind of look. I wanted to add a little bit of spunk to it versus, you know, just everybody with perfect teeth. So I thought it was cool to have little like gem on the teeth. But we use mostly for post, you know, when we're doing a fun kind of photo shoot, we do it for post, like if somebody had a smile makeover, or even, you know, braces and they're interested, it's a fun thing to do, and they get to share the pictures.
Now, who's your assistant here? Do you get it?
That's mom.
Oh, that's the mom, the patient's mom.
Yeah.
That's cool. They get to be involved. Get to be the reflector holder for a while. Yeah, that's cool. Exactly. Now, this is pretty cool because, like, you know, I think about it. I wish the guy that sold me my suits had like a photographer.
You could have done gotten some headshots out of that for the price of it, right?
That'd be a nice feature, right? You come in, you get your tailored suit back, you do the try on, and then you get like a couple of nice pictures. Yeah, that'd be nice.
Right, and you feel like $1 million now.
Yeah. I mean, you know, that's a cool thing. Do you get I mean, everybody likes having their picture taken, I think, in the end, and everybody likes. Now, have you thought about doing like a photo collage as a big piece of art for your office or anything?
I mean, I've thought about, you know, just putting up photos individually, not necessarily as a collage, just because I wanted to kind of blend into the surroundings. But I'm kind of being very cautious in what I put on because I don't want it to feel too eclectic. I want everything to blend. Okay. I don't know. I'm a bit obsessive about those things, I guess.
I think I don't think you would like my office. I mean, at least my personal office. I like see things I like, and then I'm just like, yeah, I like that. That's going on my wall. So nothing like makes any sense. It's just like a room full of things.
Personal, but if I'm trying to design a space, then I want to plan it together and overthink it, I guess.
No, I think that's really awesome. I did a job at a dental office, I don't know, about 9 years ago, and a cabinet maker thought like I was someone I was not, and was like, so which rooms does this cabinet go into? And I was like, I don't know. And he's like, well, I just couldn't remember if this was the right color cabinet for this room. And he's got 6 cabinets out, and to me, they're all the same color. And I was in photography, and I still thought they were all the same color. He's like, these are 6 different colors of white. And I was like, seriously? And he's like, yeah.
You need a woman to tell the difference. You know, I read, I don't know if it's true or not, but you know, they say that women are more kind of noticing the different variations. They're more astute to minor variations of color, I guess. So they say if you're going to do shade selection for, you know, patient's crown or veneer or whatever, ask in your male dentist, ask your assistant.
That could be, you know, because I do feel like I have, you know, I feel like I have a trouble with color. Like I have to, you know, when I do photography, I cheat. I use a gray card, because like if it was up to me to like visually identify what was the correct coloration of something, I'm never going to get there. I sometimes had to ask people if I'm wearing a blue shirt or if it's black. Like if it's dark enough, I can't tell. Like I'm like, yeah, I think it's black. They're like, no, that's navy. And I'm like, how do you break that down? But and then you sent us this cool so I just grabbed these shots out of your you know, like kind of your collection there. But this was your guys's like, so this video, that is like your put together edited video. Like what might you sort of use this for? Like your Instagram or
Well, I
just
was
your
gonna
thing?
do this mini lecture at the AACD, and then the meeting was canceled for COVID, and so I was gonna post it in the presentation.
Well, let's watch it because it was really cool. And this time I'm gonna leave the audio on. That was neat. So how I gotta ask how many cuts? Like
How many cuts?
how many times did you take different videos
The
before
video,
you
not
found
that many times, but the photos, you know, to get the right hearing, because she was, you know, shaking her head.
Yeah.
And you're trying to catch the hair at the right moment, and then the face in the right moment. So that was a lot of failed attempts until you find the right one.
Oh
Because you know,
no, yeah.
either your face is weird, or you know, the hair is weird, or it's unfocused. Oh, that's
Right. This was cool. Like this shot in particular, that's a very cool. Who picked the outfit?
I put, well, so she brought her clothes, and you know, I picked the outfit for her.
That was very cool. I like the jacket. I like it's like fun. You got like a jacket and a t-shirt.
Yeah.
And the video quality, obviously, as I'm playing it right now, doesn't even really do it justice. Like from the original video file, it's like the HD it's so crisp. It's really nice. And so you were gonna do a little talk at the cosmetic dentistry.
Mm-hmm.
Do you know if that's being rescheduled or?
I don't know. Well, I don't know if it's going to be rescheduled or not, or if it will be something different. You know, it's everything is you know, it's everything is new, you know, with the COVID closures and everything. Nobody knows what to do, I think. So it needs some time to figure out, you know, what's happening.
Right.
You know, as people are trying to move on.
How about you? Do you want to go back to in-person meetings, or are
Oh
virtual
yeah.
meetings cool?
No,
I want.
definitely in person. You know, it's different. It's just like online school for the kids, right? It's, you know, maybe you're you know, you're, let's say you're learning everything, but it's just that in-person interaction with people that, you know, is important.
Yeah. I think there's definitely there's even with a presenter on on a stage versus a presenter on a screen, there's you get more of a connection with a human being that's talking to you in the same room. I mean, obviously, so it's like when you go to, you know, I'm a nerd, so like I go to like a Star Trek convention, right? And like if I get to see Captain Picard, you know, on the stage, obviously it's different than watching him on my TV. It's just cooler.
Right. Yeah. I mean, you see them on TV all the time.
Right. And it's clearly not the same. You know, it's not that same connection of, you know, or so, you know, hopefully we get back to these things soon. So like I know, so you guys do like everything in your office, because do you I think I saw that you were in the American Academy of Implant Dentistry as well.
Mm-hmm.
So I mean, do you feel like, you know, so I mean that's a lot. I don't see, you know, I work with a lot of dentists, and I don't normally see cosmetics, implants, ortho, you know, all in one wheelhouse. Like did that take a lot of extra time, first
It
of
does.
all? Like
Oh yeah. Oh yeah. But it's really interesting because everything interplays with each other so much. So your knowledge from one discipline really helps something else that you're doing. So, and then it makes more sense, I think.
yeah,
You know, everything, you know, makes more sense in terms of the treatment planning. But I mean, we don't do everything.
What what don't you do? That's an easier question.
Like it's something like endo, like complex endo. I don't really do that. I don't really do wisdom teeth, impacted teeth.
But
I don't really do much sleep at this point unless it's expansion.
well, I think that those three things tend to I mean, those are so like oral surgery and then like endo are definitely tend to get off into super specialties. But yeah, I wonder how much more I'm going to see cosmetics and implantology being something that, you know, dentists aren't referring out anymore, because to me, like, I mean, if I go to a dentist and I like trust them and stuff like that, I don't really want to go someplace else for my veneers. You know what I mean? So I do think that's cool. And, you know, I think for me, like when I saw like your photo booth idea, I was like, well, that's probably a dentist I'd be more, you know, I like as a patient, if I was walking into that, I would think to myself, well, if this dentist takes pictures of their patients, then clearly they just have like a kind of more like an ingrained reason to have a more aesthetic approach to my dentistry.
Yeah, I mean, I think a lot of dentists, they have an artistic side. I mean, I think they have to have somewhat of an artistic side at least, but this way you're kind of letting that shine, you're putting it out there, so it's very obvious. And I like it. I think patients appreciate it. You know, you want to show a little bit of personality, I guess, so that they, you know, you're a little bit unique. You don't want to have the same Patterson office as everybody else.
Right. I mean, I think dentistry definitely is an artistic profession, or at least maybe some of the best dentistry is, because it's hopefully this isn't a bad comparison, but it's like it's like the difference between someone who does house framing, you know, so you put frames together, you throw up walls, and eventually a house gets built, versus a carpenter that's building you know, a dining room table. And, you know, you're going to see the end result of every cut that a master woodworker makes, because, you know, they're giving you a piece that's in front of everybody all the time. And I think about dentistry, like, you know, it's your hand, tactile influence to the tooth, you know, and then in the drilling is one aspect, but really it's the finishing of you know, even a simple filling, like
yeah, the composites are very artistic if you're going to do them well, right? Exactly. Yeah, you know, it's nice having patients coming in for recalls and you're looking at your work and you're admiring it rather than being like, who did this?
you're right. You know,
That's,
and when they're happy with it too, you know, is like, I think, you know, that's a wonderful thing. You know, right. And what do you use for just, I mean, like if you're trying to get just in the operatory photos, you talked a bit about you use an intraoral camera. Do you ever bring in just a DSLR with a ring light, or?
Yep. Yeah, that's what we usually use. So we have the scanner, and then they're getting the scan, so they see everything there, and then you can extract the intraoral photos from that. But especially if they're going to be doing any complex dentistry, then we'll take the DSLR photos as well.
Wow, like there's a lot of work going into a really great patient experience here. And then I wonder, like do you ever have trouble like trying to get that expressed to the patient so that you get them? I guess is like that like there are things that make you different than maybe the dental office up the road, but does the patient know it?
I mean, the things, if you're going to focus on patient experience specifically, you know, they're the things that you're doing for their comfort. I mean, if they're not noticing those differences, then I guess the question is, should you be doing that? So, I mean, the things that people don't really care for, then we wouldn't keep doing that. Because, I mean, let's say, you know, if we're giving them warm towels or something, if nobody wants them, you know, I don't care if they take a warm towel or not. Like, it doesn't change my dentist, change my my day at all. It's more for them. So, if let's say they don't want it or they don't want the massage or something, then I would maybe reconsider if I should be offering it.
Okay. I
Does that
gotcha.
make sense? Is that a did I
Absolutely.
adequately?
Absolutely. And, so I mean, only an extension to that, is like, so it's like, okay, so it, how dentists like shade match and things like that, and getting I mean, there's no such thing as perfection, but getting this amazing shade match. And some people are putting a lot of effort into that and using a lot of great tools. It's like your Trio scanner and such. And sometimes I wonder, like, it's like my family will come to me and they'll be like, what dentist should I go to? I think I need an implant, and I'm like, I don't know, where do you live? And that I gotta go do some research, right? It's like, I don't live there. But like, in the concept of, so for my family, they only went to their dentist for a long time. And then, I mean, sometimes their dentist, they've got a new dentist and they like their dentist. I'm not saying they don't, but like, then they need this thing done. Maybe they want veneers, and their dentist may not even do veneers. And then they're asking me, like, almost like patients don't like if you're getting an implant in, like, I've seen implants done with film x-rays,
No CT, no surgical guide, just
no pano,
exploratory surgery.
and and you can, I mean, there's no one stopping someone from doing that. And then I've seen, and then like, but I'm talking like even 15 years ago when people were first getting 3D CTs in their offices, and they were, starting price $220. And it's like, how did the patient know that this person using this really cool piece of equipment, or this, or that had this advanced training? Like, how does the patient know to go to that person? That's always been my question.
Because patients don't really know what it needs to be there. I see a lot of really bad veneers, for example. So patients, or other things, because patients don't realize what should be done, right? What technology should be used. And I mean, not necessarily that it should or shouldn't be, because, it wasn't necessarily done like that before, and maybe
Right.
doing that and getting good results. But, certain steps still need to be taken. And yeah, patients don't really realize if steps are being skipped. Like, I've seen veneers where they're all like canted because they didn't take a plane, a reference for the, our Facebook record, or at least like a bite stick thing,
Right.
relative to the face. So patients don't really realize. So I think especially if you're doing those steps, I think it is important to have a little speech, just, describe what you're doing or why you're doing. And it's not just because, you want them obviously to appreciate the technology, but if they're gonna, some patients are like, why are you taking so long, assessing for this, right? And so you want to explain why something is being done, so that they're a lot more accepting of doing that. Like, let's say the rubber dam, for example. Like, I like to use the rubber dam a lot, but it doesn't feel good, if unless I explain that it's going to be a better quality restoration for them, they wouldn't like it. But if I explain, first of all, why I want to use it and what benefits they're getting, they're all for it, and they don't mind if it's, putting some pressure on the tooth or something like that.
Have you had any patients that are like, well, my other dentist didn't say I needed to fix this? And then, like, if you have, how do you deal with that?
So, first of all, we figure out what they actually want. Especially if we think they have certain issues, we always have to tell them what their problems are, because if we don't, that's liability for us, right? Because then, they could, let's say if we miss a big cavity and, they're not doing anything, just simply, then it's, somewhat our fault if we missed it, and then they have to get an extraction or a root canal. So, we gather the data, we show patients, let's say they're, they have a major, occlusal issues. Let's say they have a major wear problem. Um, let's say they need a full mouth rehab, for example, but they're not concerned about anything. Um, we have to try to gauge what their level of acceptance of treatment is going to be. And then we gather data on them. We just explain what the problem is. We show them the problem and, see if they have any concerns about fixing it. Like, let's say if they're concerned about the aesthetics or about eating, or let's say they're breaking teeth, then we start talking about what are your options to fix that. And then patients are more accepting. I think just using that problem focused approach, showing the problems, and then the patients can decide what they want to do rather than just building a big treatment plan. So we don't necessarily blame a certain filling that's leaking or that someone else maybe didn't notice. We'll show them the issue. Maybe you could say, maybe the other dentist was watching this before, but now it's getting worse because, of this radiolucency here. Or did I answer your question? I think I kind of went
Yeah.
off.
No, absolutely. I totally, I absolutely got what you were saying. Like, both, you need to let them know what's wrong, and I'm sure just because you want them to know as well, but also, you don't necessarily want to just throw, okay, here's an estimate to fix everything in the world. And to get an idea of what they're looking for as a patient and to maybe help them prioritize. And, I really appreciate that. Obviously, they like their past dentist, and you never know, like they might not have seen their dentist for 5 years. So they're like, oh, I just saw my dentist and he says it was fine. It's like, 5 years ago, that's, that could be a long time in cavity world. And, yeah, so I totally got what you're saying. And that's just I just always curious about that, because that does seem like, and I would say across a lot of different professions, I can walk into someone's dental office and they're like, what type of equipment should I have in here? And I'm just like, everything you have is wrong. That's probably going to be a short conversation then. They're going to be like,
because they're not ready to upgrade everything, right?
Right. And also,
like let's say they were just looking to go digital x-rays or something, and you're like, oh, you need a CBCT in here and a scanner, 3D printer and all this other stuff. And they're like, well, I just wanted the x-rays. Can I just get
right. I just wanted a new monitor on my computer, and I just give them a bill for like $300,000 and leave. I'm just like, this or nothing. I'm done with you, but no, absolutely. And, the professional courtesy of like, whoever did the office to begin with, I'm sure was trying to meet the needs of the client and trying to provide the best services they felt wise. So, there's always that. I hope that, patients of dentistry out there start finding these chats, because I think a lot of just the general public, would be really interested to see just how much effort dentists really put into their work. And just like in every aspect of their office, there's 1,000 things going on in a dental office that a dentist needs to be an expert on. And we're not even going to touch the big things that, technology is such a small piece, and if patients knew just the amount of time and effort that the dentist put into picking the right composite, and I really hope that they start learning a little more about their dentists and dentistry so that they can appreciate, the dentists are putting in the time and work,
Yeah, I hope so. I mean, I don't know. I think most people, they don't really appreciate, all that work that goes in, or they care that much, but, definitely a subset of people do. And I definitely hope more people are more appreciative of all the effort that goes in to take care of them.
Sometimes it just takes a little information gets out there, and people can expand their understanding of a profession. And a lot of times the people that will find the information are the people that most need it. They're the people looking to have dental procedures done and looking to understand a little more about cosmetic dentistry and cosmetic dentists and implants, you know, because once you need the procedure, then you start looking into it. Well, I really appreciate you coming on our chat, and it's getting late, so I hope you have a great evening.
Okay, yeah, you too. And nice chatting with you, and hope to see you again